Hello, we are here with Mr. Patrick Rayfield from Artemed, and my name is Alberto Rullan with Performance Equine Veterinary Services. Patrick, thank you very much for being here with us.
Absolutely. Thank you for having me.
We're going to have a great conversation today about Artemed, osteoarthritis, and how we use Artemed in horses.
Very nice.
Awesome. I'm extremely excited to have you here with us. The first thing that I want you to talk to us about your product, how it helps the joint in the horses, and what's being done, what kind of research we have. But first, let us know a little bit about yourself, about how you got into this, about that.
Actually, started 17 years of human medicine and pharmaceutical sales, and ended up going into human spine surgery and brain surgery sales with biologics, and we had this little device that was treating with PRP, and just randomly found out that actually they used PRP in horses, and didn't know anything about horses. I actually was kind of a little bit afraid of horses, and but we went and met with a horse vet, and he said, indeed, yeah, they have platelets in their blood just like we do, and horses respond very well to PRP. So we showed him this system, and turned out to really alter the course of how he treated horses' joints. And so I just followed him around for about a year and a half and studied how he treated horses, studied the joints, studied everything about the anatomy of the horse, and just kind of fell in love with treating horses and seeing how well these horses would respond to, say, a biologic. But literally treating and changing the lives of these horses and changing the lives of the horse owners just became a passion of mine. And so I was kind of almost retired a little bit, and Artemed came around. They invited me to take a look at the product, and I wanted to be involved with a product that was really a game changer in the industry. And so out of the 14 trials that are done on polyacrylamides, 12 of those are actually done on Artemed. And so when I read through all those trials and really studied how the trial was treating the horses, treating the joints, and the outcomes of it, really fell in love with this product as a game changer. And one of the reasons why was the product for the last couple of decades, we're really treating osteoarthritis, and we know 60% of all lameness in these horses is really caused by osteoarthritis. So it's a highly occurring event with osteoarthritis, and but treating the symptoms of the disease, we're treating the swelling and the pain and the comfort level of the horses and the performance within the joint. We chase symptoms, and as we chased symptoms, we allowed the disease to actually progress and to get worse, and then to get end stage, and then to have cartilage damage, and it was really doing a lot of damage. And what I saw in the trials with Artemed is that it really treated the disease rather than treating the symptoms. And if we can treat the root causes of the disease, we can slow down or prevent the progression of osteoarthritis and bring longevity to the joint, bring longevity to the career of the horse, and really make the horse comfortable throughout its lifetime. So I fell in love with the fact that Artemed really treats the disease rather than treating the symptoms.
That's a great point that you bring, because sometimes there are many things that I like to clarify to our listeners, and one of them is the disease of arthritis. And second, I want our listeners to understand, okay, what Artemed does to actually treat that disease, not just decrease the inflammation and be a pain med, all right? So first, talking about the disease. So we know that in general, right, we have some sort of traumatic event whenever we're talking about traumatic arthritis, rather than a genetic or degenerative genetic arthritis. So we're talking in this particular about the traumatic one, for example. So we have an event, then we have an inflammation, the inflammatory cascade, right? We have a lot of, most of us see these in the horse as the joint filling up with fluid, having extra synovial fluid because the joint is trying to heal itself. Then that becomes like a cascade effect, right? And then at that point, other things start getting affected, like the cartilage, the synovial lining, what's around the joint. And then we start seeing bony changes like osteophytes, or we call it spurs, etc. where in that process Arthromed helps?
So we know that those traumatic events that you're talking about are really tears and defects that happen within the synovial lining that allow for those inflammatory mediators within the body to get into the joint. Once those inflammatory mediators get in there and start to cause the inflammation, to bring homeostasis back to the joint, the body's really, it wants to inflame itself.
Before you go, homeostasis. Define homeostasis, because some of us do not know what that means.
Okay, and so all right. So homeostasis really is just normality within the joint.
Okay,
So
got it.
health and a normal, healthy environment for the joint. So
Got
a
it.
happy environment for the joint. And we know our bodies, humans, animals, whatever, our bodies are constantly in a battle to bring homeostasis or normality to our bodies and health within our bodies. So we know that as these inflammatory mediators are getting through those tears and defects of the synovium, that it degrades the quality of the fluid. So we start to get some angry fluid and some angry joint within, or an angry environment within that joint. And that starts to cause the degradation or the buildup of osteoarthritis. So as we were developing our Arthromed, we saw that once Arthromed gets into the joint, it actually acts in two ways. It acts as sort of viscose supplement or a product that really gets into the joint to lubricate the cartilage head, to give cushioning to the joint, to give some comfort to the joint. But within a couple of days, pressure within the joint starts to push the scaffolding or the polyacrylamide portion of Arthromed to the synovial lining. And so as the Arthromed gets to the synovial lining, it starts to adhere itself to those tears and defects. Well, macrophages that come into the joint decide, well, this is kind of a foreign substance. We want it out of the joint. So it actually grabs it, but the molecules of the Arthromed are too large for it to actually eat it or get rid of it. So it really pulls it from the intima layer of the synovial lining into the subintima layer. So it sets up its home base in the subintima layer of the synovial tissue and builds a scaffolding that encourages tissue growth and vascular growth to really heal the synovial lining. So if we can stop the tears and defects from allowing the inflammatory mediators to come in as a scaffolding, it actually filters out the inflammatory mediators to allow the joint to bring itself back to homeostasis. And as it does that and heals the synovial lining, the synoviocytes, which are actually responsible for the quality of the fluid within the joint and the stability of the joint and elasticity of the joint, at those tears and defects will go from a 1 to 2 cell layer thick to a 5 to 6 layer thick. So you actually get a little hyperplasia of synoviocytes at those layers to bring more elasticity to the joint, more cushioning to the joint, and better fluid and higher quality of fluid within that joint. So by healing the synovium, you actually bring homeostasis back to the joint and slow down or prevent osteoarthritis from actually progressing, because we've really stopped what's feeding the osteoarthritis.
That's a fascinating science, and you did such a good job explaining the science behind it. Now let's backtrack just a little bit, because when the polyacrylamides first came out, one of my first questions is, okay, what is a polyacrylamide? It sounds like something people put in nails, or I put in horses' nails, or is some sort of a chemical that we have no idea what it is. Can you backtrack a little bit on, because you mentioned that the cells of the joint, like the macrophages, cannot grab it. So what is it?
So Arthromed actually is 2.5% polyacrylamide and 97.5% sterile water. So water makes up our entire body. So the water molecules will actually interchange within the joint very, very well. So as 2 decades worth of research and development on how can we form a scaffolding within it to literally heal the synovium, we worked with many different mixtures of the water and the polyacrylamide. And once we came upon the 2.5%, we saw a change from the mechanism of action of just cushioning and lubricating, which some of the other polyacrylamides are responsible for, but also the integration of it into the synovial lining. And that mixture of 2.5% was the magic mixture, if that's kind of how you want to understand it. But it really is a plastic scaffolding that helps with cellular growth and tissue growth.
That's that's fantastic. It's mind blowing how some scientists come up with this
Yes,
cool stuff to help the
it's
body.
fun. I was lucky to actually visit our facilities in Denmark. We're actually manufactured in Copenhagen, Denmark, in an FDA-approved facility that has 3 regulatory bodies around the world approved it for use in humans and in animals, in Europe and New Zealand, Australia. So it's a very highly regulated facility and a very safe and very clean and sterile environment that where this product's produced. And it's amazing to see how every single syringe that comes out is inspected for quality and quality assurance, which brings a trust within us, delivering a great product, but also a trust in your world as a doctor to be able to trust that this product is going to be safe and effective within the animals that you do treat.
Every single syringe gets examined.
Every single one.
That's amazing. Which brings me to my next topic, because some at the beginning, some of my reservations were, okay, this is not a natural product. This is a synthetic, and there are many, we could say dozens of products that we can put on joints, right? And every injection that you put in a joint, just by putting an injection itself, has certain level of possible complications. So
Right.
I was very hesitant at the beginning to use a complete synthetic. And the more I use it, I get a little bit more comfortable. And by you telling me these things, it makes me a lot more comfortable. And I also show me also, of course, why I haven't have any reaction. I haven't have any infection with the product. And I feel very safe of using it in any joint of the horse.
Right.
So let's backtrack a little bit on the uses of polyacrylamide and artemis. I have used it in early stages of the disease, mid stages, and late stages.
Correct.
Usually, and I think it's a little bit unfortunate in our part, and that's part of what I want to educate and work with our listeners and our clients. Usually, we go to polyacrylamide when we see bad radiographic changes. We
Right.
see big spurs, a lot of inflammation. We have already used steroids. We have already used some sort of biologics like PRP, etc. We have already used others. Now, how do you feel? What is your feeling on using these very, very early in the
Right.
disease process? And how are veterinarians around the world using it very early in the process? What is their diagnostic approach? How are they deciding to put it versus not putting it? Can you tell us a little bit about that experience?
Sure. So Artemis actually indicated for all phases of osteoarthritis, which kind of sets it apart from other polyacrylamides that may be on the market. And because, as I mentioned earlier, that really does 2 things. One, it acts as a viscosupplement to cushion and lubricate a joint. And that really is very helpful in those late stage osteoarthritis cases where you do see huge radiographic changes. But one of the beauties of this product, and that separate this product from all other polyacrylamides, is that it integrates itself into the synovium, which, if we think about the earlier cases of osteoarthritis and say what I call the itis phase or the synovitis phase of the development of osteoarthritis, if we can heal that synovial lining as arthritis is starting to develop, or the earlier phases of the disease, we can actually prevent that joint from progressing to the end phase. So the earlier, the better, because we not only do we cushion and help that joint be comfortable, but we actually heal what's causing the arthritis. So if you can catch it in the earlier phases, even before radiographic changes, you just got a little synovitis and you're starting to see some lameness start to develop and some pain within that joint, it's a perfect time for Artemis, because it actually will set that joint up for success, rather than just treating, say, a symptom and basically setting that joint up for failure.
And that's amazing, because I used to think that the only thing that would change a joint or prevent it from getting worse would be stem cells or a stem cell product.
Right.
So it's very, very good that we have studies proven that we can actually change the joint itself.
Correct. So, and just like a stem cell product or biologic that is trying to heal, because of the platelets and the growth factors and the IRAP and everything that comes out of those platelets are really trying to heal its environment. By the same way, this product, when it's healing the synovium, actually helps those products do what it's trying to do. To quote one of the highest users of this product, Dr. Jason Lowe, out of Australia and New Zealand, he has treated thousands and thousands of joints. His one statement is that an Arthrimid-treated joint earlier in its disease becomes an easier to manage joint for the life of that horse. Meaning that once that synovial lining is healed, the horse's joint is going to respond better to its maintenance doses of a steroid or biologic. So you're going to get better use of the maintenance products after the joint has been treated with Arthrimid.
Got it. So what you're saying is that we can still treat those joints with other products
Absolutely.
if we wish to.
Yeah, absolutely. And it's just maintaining. Horses kind of do stupid things, and they're going to re-injure that joint or re-aggravate the joint. And while Arthrimid has healed the synovial lining, you do have to probably come back in at some later date to manage the joint with another product, like a steroid or biologic.
Oh, yeah, it makes me feel real good because at our practice, we use biologics every day, and we believe that biologics are going to be the future of this industry, especially because the first thing is, above all, do no harm, right? And there are plenty of studies that show how the corticosteroids could cause harm in the joint. So we use a significant amount of biologics. Makes me feel really good that I can do Arthrimid and then also treat with the biologic.
Absolutely.
Maximizing the health of that joint and significantly elongate the athletic ability of this horse. Some of my biggest frustrations on the industry is that we're seeing, whether it's a racehorse, whether it's a show horse, jumping horse, a jumper or anything, we see them first on the 3-year-old, 4-year-old, and you see this horse with an extremely great potential, and then all of a sudden you don't see it in the 5 or 6-year-old competing anymore. Mm-hmm. And one of our goals is to take these horses, and 60% of the cases is because of osteoarthritis, maybe even more. So it's awesome that we have now a product that we can actually do that.
Right. One of the beauties of this product and the studies I mentioned, the 12 studies that were out there, one of the main studies was NIBAR, very, very popular study out of New Zealand, Australia, in conjunction with Dr. Jason Lowe. It was a 24-month study. We wanted to see the longevity of this product and how long it actually produced health within that joint. So we looked at, it was 43 horses, and 2 mLs of Arthrimid were actually injected into the metacarpal phalangeal and the middle carpal, metacarpal, kind of hard for me to say, joints within that caseload of 43 horses, all thoroughbreds. And we looked at months 1, 3, 6, 12, and 24, and at 1 month, 59% of the 43 horses were actually completely lame-free, and we saw a progression of health along the course of the 24 months. So at 3 months, 69%, at 6 months, 79%, at 12 months, 81%, and then again at 24 months, 83% of those horses were continued to be lame-free. And we stopped studying at that point. We said 2 years, nothing else on the market is going to give you 2 years of longevity within treatment of just one treatment. So we stopped studying it at 24 months, and some of these horses are continuing to get better. But at 24 months, 83% of those horses were completely lame-free. So we see a huge longevity of this product to help with the confidence that the joint's going to bring better performance, longer performance, better health for that horse, for the longevity of its career, and then comfort in its later life as it ends its career, and it just becomes a nice horse.
That's fascinating. I don't think we have many studies of many products that could actually do that.
Right. In fact, we also studied it as well. Dr. Clifford, Dr. Lowe actually did a study to look at how Arthrimid compared to hyaluronic acid and triamcinolone. So we wanted to see when those horses, when we treated, it was 31 horses, and they split the horses out, and They did, let's see, it was middle carpal joint lameness in racing thoroughbreds. And so we treated a third with Arthamid, treated a third with triamcinolone, treated a third with hyaluronic acid. And of those 31 horses, 83% of the Arthamid treated horses were lame free at 6 weeks and continued to be lame free at 12 weeks. And then only 27% of the triamcinolone group were lame free at the 6 week period, and 40% of the hyaluronic acid were lame free at 40% at 6 weeks. So you look at a performance against some of the leading products that were a part of joint treatments, and Arthamid outperformed those. It was a very significant trial for us to see how well it was performing against some of the industry standards.
Makes me want to throw out all my HA out of my lameness
Well,
box.
it's not necessarily throwing them out, but actually save them for after we treat Arthamid.
Yes.
And so you treat the joint with Arthamid and then come back in with some of those other maintenance products later in the disease to help that disease to really be healthy, help the joint to really be healthy.
You're so nice. You're like, let's collaborate with whatever is still available.
Absolutely.
Collaboration is the new currency, right? So let's collaborate with what we have available. That's very nice of you guys. In our practice, we do a significant amount of arthroscopies. Mm-hmm. We do arthroscopies on yearlings for OCDs, on fetlocks, stifles, hocks. Then we do also arthroscopies for older horses that have meniscal injuries, etc. Can you tell us if there's any stories of any of your experience or recommendations for how to use this product after surgery for young horses, older horses, whatever you can tell us?
Absolutely. So you would just use Arthamid as it's directed, but give that area that you've done the surgery 6 weeks to recover. So after 6 weeks, go right in with Arthamid just the same way that you normally would a healthier joint or a joint that has not been through any type of surgery.
Excellent. Now, the most common question I get from all my clients by far is, how soon can I go back to work? So I have a horse that comes to the clinic. It has fetlock osteoarthritis. We treat the horse. When can that horse go back to work?
Okay, it's very important for a 48-hour period of complete stall rest. Anytime we stick a needle in a joint, we want to give it some stall rest, right? And so 2 days of stall rest. If we can get 1 week after that as a light turnout, hand walking, very light turnout, to give the product time to set up within the synovial lining and start that integration process. And then after that week, let's slowly get them back into a workload. So 12 to 15 days of good rest, and then let's get them back into their workload. One of the trials that we did, and this just came out last year, we took horses straight off the racetrack, grade 3 lameness, with 2 mLs into the medial of the stifle, coming off the racetrack. We actually gave them the 2-day stall rest and then put them right back onto the racetrack. We wanted to see what happened without the rest. 72% were actually lame-free at the 12-week mark, so the product worked, but the longer you can give them the rest, the more that integration process can happen and you get more longevity out of the product. So if you can get some rest, let's get some rest. Mm-hmm. But the typical is going to be 2-day stall rest, a week of light turnout, and then let's slowly get them back into work.
Okay, got it. Thank you very much, because sometimes the truth of the matter is that we're treating athletes, mm-hmm. and any athletes, just like football players, basketball players, hockey players, or soccer, they all have a schedule, right? And it's good to know that we can actually adapt to this professional athlete's schedule.
Yeah, I think one of the main things, and what's very important to remember about Arthamid, is it's not a quick fix. It is a progression of health that the longer the horse goes. And so we're looking at about a 4 to 6 week period of full integration into the synovium. So it's a slow heal, but once it's healed, it really lasts an awful long time. So it's not a quick fix, and sometimes you do need a quick fix, and that's not what Arthamid's about. We need to get the Arthamid in there and let it do its thing. And when it does that, and if we slowly get health back to that joint, we're going to get better health, for the longevity of the joint.
Perfect. All right. This was a lot of information here.
It's a lot of information, a lot of science behind a very simple product, and which gets me excited every time we see success stories every single week. We hear we will get a phone call from a vet somewhere around the country, and vets all over the country are using Arthromed now, that say they start off the conversation with, "You're not going to believe this case."
Awesome.
And so that's one of the things that drives me as a regional manager for Arthromed, and just literally gives me excitement every morning of going and meeting with vets to talk to them about the success of Arthromed.
One last question before I let you go.
Sure.
'Cause, all over the world, we know that there are other countries that use similar products in people,
Mhm.
people's joints. Is there's any another question that I get a lot? Is any other country that uses similar products also in people? Is this available in other countries for people as well, or in the United States? What's going on in that
Absolutely. So as I said earlier, has been approved by 3 worldwide regulatory bodies to actually be used in animals and humans. So right now, the bulk of the studies are done in human knees, and it's been used for about 4 or 5 years in Europe now in human knees. The studies will show that the product lasts for between 8 and 10 years in a human knee.
Wow.
And number one complaint is a little bit of pressure within the knee, but that pressure goes away very quickly. And the stability of the knee and the health of that knee, it's incredible to hear the statistics of the success in human knees. So absolutely, the answer to your question is yes. It has been used in Europe for humans for, like I said, about 4 or 5 years. But the product started out as a facial reconstruction cosmetic type product, and was labeled Bulkamid at the time. We used the product next in women's incontinence as a bulking agent around the urethra, and then it found its way into the joint. And so the product has been used in multiple areas for the last 2 decades. So it's not new science, but it's exciting science, and it's advancing our treatment of specifically horses here in the U.S., where we're looking for approval on the human side very soon in the U.S. as well.
Fascinating. Well, so this was an amazing conversation with Mr. Patrick Rayfield from Arthromed, and everything that you guys hear on this interview, plus more, you can find it in our website, which is www.performanceequinevs.com. www.performanceequinevs.com. We're going to put a link to the Arthromed website if you want to learn even more science about the product. Right? So thank you very much for being
Very
here
good.
with
My
us. It was
pleasure.
extremely good information, and we'll keep treating horses with Arthromed.
My pleasure. Thank you for having me.
Thank you.